Hello, everybody. Welcome. My name is Kanita Marslin. I am the health coordinator on the Justice, Health, Equity, and Safety team. It is a privilege to be here with you all tonight. I want to welcome you to our harm reduction panel. The Office of the Public Advocate is hosting this discussion in our efforts to understand the robust work being done around the city and to give you several angles on harm reduction with the panelists we have today and the wonderful work they're doing. I want to thank all the panelists, and I'd like to introduce you to Solomon Acevedo, the Deputy Public Advocate of Justice, Health, Equity, and Safety.
Thank you, Kanita, and thank you, New York City, for tuning in and being available for this amazing conversation with a panelist of experts with lived experience and education that informs us about things we don't normally think about regarding people who often are ignored. And so, again, we're grateful to have a wonderful lineup. You hear more about who they are as we begin. And like I said, we're talking about the growing attention that's being placed on things like the overdose crisis, and in the United States, substance use and overdose has increased. And according to the CDC, there were more than 100,000 drug overdose deaths in the US during April 2020 until April 2021. That was a 28% increase from 78,056 deaths in the year prior. And still, there has been federal and local pushback to implement harm reduction methods. A literature review on structural interventions to reduce HIV transmission among people who use drugs found that some policies designed to reduce drug use might actually increase rates of HIV transmission. The first overdose prevention site in North America was opened in Vancouver, Canada in 2003, and since then, this site has seen more than 3.6 million people with 6,400 overdoses and no deaths. That being the case, we want to share to our panelists and open up the floor for them to tell us about their organization and let us know about what they're doing to respond to this situation. And anybody can set it off. So whoever wants to have the courage to go first, feel free.
Greetings, everyone, and thank you for having me. I am Hiawatha Collins. I guess I'm not the silent one in the group. So I am, once again, I am Hiawatha Collins. I am the founder of the Peer Network of New York. I am also the board chair for Vocal New York, and I work for the National Harm Reduction Coalition as the Capacity and Community Building Manager. Let me tell you a little bit about the Peer Network first, and then I'll get to the question. The Peer Network is an organization that was founded by myself and a partner of mine who is doing other things at this time, comprised of three co-directors at this time. But we are a community-based organization that's been around for 11 years. We get less than $19,000 funding. We are peer-based from the bottom up. We believe in personal and professional development. We do everything from outreach to community engagement to community trainings, and we also do advocacy. There's nothing that we don't do. We believe in professional and personal development. People forget about the personal part. Everybody wants everybody to be so professional. They want everybody to be prepared for work. But what about the person themselves? What about childcare? What about, is the person ready to work 8 hours? Creating safe spaces for them to be able to have dialogue and to be able to talk about whatever it is that they may need to talk about. So it's person-centered first and foremost, and then the work comes in that. So the work is diverse, but when we talk about working with marginalized communities, we're talking about with people that, I don't even like using the term marginalized. I'll be honest with you, but that's the terms that's being used. The thing that's important to understand and know at the Peer Network is that we base everything in harm reduction first and foremost. And harm reduction starts with love, treating people with dignity and respect. Your friends, your fellow peers, your fellow community members, and everything. Every day in this city, we walk over individuals that are vulnerable. There's a quote that I love so much, and it says that we know a community or a society by how it treats its most vulnerable people. So we have all these homeless people out in our community, and we walk by them each and every day. We have people who use drugs and they're taboo to even talk about or to try to assist and help. Well, we're here to try to help them and assist them, but not telling them what they should do, not telling them that they need to stop using because they're gonna do that whenever they're ready to. But to provide a place where they can be treated with dignity and respect and they can be heard. I'm not gonna be long-winded, but that's what basically the peer network is about, and I'm gonna allow my other panelists to speak right now. Thank you.
I can go next. Hello, everybody. My name is Mimi Shelton. I use she, her pronouns. And the organization that I'm with is Destination Tomorrow, the Bronx LGBTQ Center. My position there is the Director of Transgender Initiatives and Services. So as an organization, I'll tell you about Destination Tomorrow as a whole. My title, it's important, but it's not like that serious. Our organization as a whole is what I would like you to know more about. I manage a grant, but as Destination Tomorrow, our mission is to get to find pathways that are economic, political, that are social, that are interpersonal, finding those pathways and meeting clients where they are to get them onto a path that gets them to the next stage in their life, wherever that may be for them, right? Whether that next step is housing, whether that next step is getting yourself signed up for certain support service benefits, whether that next step is gender affirming care and surgeries, whether that next step is finding a support group. So our idea is getting individuals off the path of needing emergency care in crisis moments and onto the next step in their destination, right? Wherever you're going. And again, we do that through a wide variety of services. We do that through outreach, canvassing, tabling at different events. We offer HIV testing on site, as well as counseling and connection to larger or continuing HIV care and testing. We connect individuals to behavioral health services, to PCP services for primary care, to gender affirming care and procedures and surgeries, as well as navigating the different hormone replacement process. We help people navigate the PEP and PrEP, which is related to HIV fields of the medical system, I guess, or PEP and PrEP navigation. Easy put. In addition, we offer some virtual programming online, in person, a host of programs with our Department of Programs. We are a grant making agency, so I actually run a grant or manage a grant by Gilead Sciences, which is a Transcend Community Impact Fund. And then we also have a whole wing of support services with case management, that we have a 90-day emergency housing program for individuals who have had backgrounds in sex work or sex trafficking, those who've been the most vulnerable in our communities, and a host of other things. With regard to tonight particularly, we at Destination Tomorrow not only have offer and partner with an agency that hosts a Narcotics Anonymous program on Fridays at 7 p.m. at our organization's site, but we also offer we offer syringe exchanges for individuals, primarily for hormones, for hormone injections. But we also recognize that our clients come from a variety of backgrounds. So if you're using that needle for whatever your practice is, for whatever substance you might be using, at least that's a safer practice, right? Because if you're using dirty needles, you're putting yourself more at risk medically for certain diseases and certain infections, right? So we do work from a framework of having safer practices for individuals, safer sex practices, safer substance use practices, and the like. And when I use that word safer, what that means is we recognize that we live in a world where people are human, where they make mistakes, where they're not perfect, and where it's going to take time to get you back on a path, especially when the reason you got off of the path for your life was due to discrimination, a lack of opportunity, and oftentimes a lack of access to resources, right? So we work from that perspective of understanding that people are going to be in crisis moments. So we are trying to figure out how to find safer ways for them to live and to exist and to get to where their next step is. So that's a little bit more about Destination Tomorrow. We work with the LGBTQ community, the trans and gender nonconforming communities, but we're also here for the Bronx community, right? So we are a community-based organization. We're at 3rd Avenue and 149th, so come see us.
I'll go next. My name is Tracy Gardner, and I am the Senior Vice President for Policy Advocacy at Legal Action Center. A Legal Action Center has been around since 1973, and it is a law and policy advocacy organization that fights discrimination on behalf of people who use drugs, people with involvement in the criminal legal system, and people with HIV. And so harm reduction and services to people who use drugs, fighting against the criminalization of people who use drugs and treating drug use like the health issue it is instead of responding to it through carceral responses has been what we've been doing for the last 40 years. And that we have been involved in a number of initiatives and innovations in New York and around the country, but particularly in New York, as New York has developed harm reduction approaches and health for drug users, starting with, in particular, the HIV epidemic, but also to address other bloodborne diseases and to ensure that people who use drugs and their families and communities have the best resources they can have. We've worked a lot on legislation that has enabled the existence of the of syringe exchange programs, of or SSPs as we call them, to decriminalize the possession of paraphernalia, which is an excuse or becomes an excuse for law enforcement interaction with people who use drugs. And we did a lot of work on the Expanded Syringe Access program, which was a legislative program started under Governor Pataki. And that was literally just the last piece of that legislation was just signed into enactment by Governor Kathy Hochul either earlier this month or late last year. And so that is the work we do through policy analysis, through technical assistance, and through litigation. We also do a lot of work for people who are on medications for opioid use disorder, who are involved in the criminal legal system, involved in drug courts, and fight against basically anybody who believes that people who use drugs shouldn't have the best health care that they can get. So I will leave it at that and let my colleagues speak.
Thank you, Tracy. I think I'll go next. Hi, everyone. My name is Jason Beltry. I am the Director of Community Initiatives and Impact at Washington Heights Corner Project and NYRI, soon to be On Point NYC. Part of my portfolio and what I do at On Point is I'm overseeing the outreach and public safety team. So we have a team of staff that are out in the community doing syringe litter cleanup, being ambassadors to the organization, educating folks, diverting public use, linking folks to detox, anyone who identifies as such, and servicing kiosks throughout the Bronx and Manhattan. In addition to that, I'm presenting to a variety of organizations and task force such as this one on what we're doing here at On Point NYC. In addition to that, I'm also the project lead on our COVID work. So we've been able to provide vaccines on a weekly basis. We've been hosting pop-up clinics in our spaces at Corner Project and at NYRI. But we've also been extending the service out to our partners in the community throughout New York City. So we've been able to partner with various organizations in the Bronx and in Manhattan to bring vaccination services to them. A little bit about what On Point NYC does. I mean, there's so much that we're doing right now. We were able to finally launch the first 2 overdose prevention centers in the United States. It's a safe place for people to come in and use the supplies that they get in the street. We acknowledge the fact that people who suffer from addiction are not only dealing with opioids, so it's really a safe space for everyone to come consume. We have 2 models. One model is our medical model in Washington, in East Harlem, and we have a peer run model in Washington Heights. We also have drop-in centers at both locations where participants can come in and access food, laundry, showers, respite if they need. Bathroom services are provided. They can also access computers and phones and talk to a case manager. We also have a hub clinic at Nairi. It's actually a Montefiore satellite clinic. There they can access buprenorphine, Hep C treatment, talk to a doctor that is on site about 3 times a week. We have nurses on site 5 days a week as well. We also offer holistic care. This includes acupuncture, sound therapy, massage therapy, Reiki, acupressure. And of course, I mentioned we also have case management and care coordination. So we're assisting folks with benefit navigation, housing applications, linking participants to care that is much needed. More recently, we've also started building out our mental health program. So we hired recently a couple of social workers, and they're going to be embedded into our drop-in centers. So they'll be able to do one-on-one sessions with the participants and identify what their needs are and build the program out that way.
Hello, everyone. My name is Marilyn Reyes. I'm co-director of the Peer Network of New York. Our agency is Peer Network of New York, and I'm also the board member of Vocal New York. What we do is we mainly focus on the personal and professional development of all peers in New York State. Then we also do and support outreach in the community. Some of it is done through partnership with other organizations. And then we do events every 3 or 4 months. We do Mother's Day events, we do Father's Day events, and we meet the whole community. We provide food, clothing, harm reduction supplies, and whatever else we could get our hands on, we give out to the community because the community is new, is a lot of need. Then we also do trainings, harm reduction trainings. We just try to be inclusive of all people, from drug users to sex workers to LGBTQI, etc. We just meet people where they're at. And in harm reduction, we do not condone, condemn, or endorse drug use or sex work. We meet people where they're at, provide them with education, referrals, services, so they can make an informed choice. Because people who use drugs and engage in sex work know what they need. So we treat them with the most respect, dignity, and love. And love is key.
I could jump in. I'm Melissa. I'm the Director of Civil Systems Reform at Drug Policy Alliance, which is the nation's leading organization working to advance policies and attitudes to best reduce the harms of both drug use and drug prohibition. And just to add some context here, building off of the amazing things that everybody has been saying, how did we get into this moment, right? Like the war on drugs that's now been waged for more than 50 years has fueled the dual crises of mass criminalization and drug overdose deaths that we're experiencing right now. And we know that while nearly everybody has been affected in some way by this policy failure, the drug war's impact and its intent has been profoundly racist, including in New York. We know that rates of drug use and sales are roughly equal across race and ethnicity, but enforcement targets people of color. And that means 87% of the thousands of drug arrests in the last few years in New York were people of color. And last year was also the deadliest year on record for overdoses in New York City. And this year is unfortunately on track to be even worse. And the most recent overdose data confirms the stark reality that we have known for years, which is that race and class continue to be obstacles in accessing life-saving interventions. That goes for harm reduction, and that goes for the full spectrum of care that should be available to New Yorkers. In 2020, New York City, Black New Yorkers had the highest rate of overdose death and the largest absolute increase in rate from the prior year. Meanwhile, overdoses decreased among white New Yorkers. So when we look at the skyrocketing overdose rates in the South Bronx and East Harlem, for example, they further reflect that systemic racism and inequity, because we know that those hard-hit neighborhoods actually have an overdose death rate that's twice as high as the city as a whole. So coming back to it, DPA is a national advocacy organization. We're working with everybody on this call and many others to try to address this crisis. We do legislative advocacy, bringing data like this, crunching the numbers, and putting it in front of the elected officials and politicians in New York, and not letting them turn away from the reality of what's actually happening on the ground in communities. And we work with our allies to end the war on drugs, to repair its harms, and to build a better approach that actually centers the well-being and dignity of people. In New York, that's meant everything from, like what Tracy was saying, expanding access to sterile syringes and preventing the spread of HIV, really stemming all the way from the late 90s to reforming the Rockefeller drug laws in 2009, legalizing marijuana to promote justice and equity, last year, working with the End Overdose Coalition to decriminalize syringes again and mandate access to medication-assisted treatment in prisons and jails in New York. I think, just pass it on to other folks, but I just want to say, given where we're at with the dual crises of mass criminalization and overdose, and both of those really stemming from the criminalization and the punitive approaches that we've had to drugs for so long, the urgency really couldn't be any more for us to start treating drug use as a health issue and really moving away from framing it as a criminal offense and instead centering harm reduction in our approach once and for all. And I'll pass it back.
I think you're still on mute, Will, if you're trying to share.
Okay. Can you hear me now? Okay. My name is Will Robinson, community leader for Vocal New York. Also, I'm a peer leader over at the Peer Network of New York and many other hats. What we do at Vocal, we're an advocacy group. What we do, we advocate for the people who can't advocate for themselves. We hold a lot of lobby visits with elected officials, and also too, what we do with the Peer Network, we also are boots on the ground. In other words, we meet the participants where they're at. We give our syringes. We give our syringes. We pick up syringes. But also, what we do, we inform the participants on anything they need. Let's say, for instance, healthcare. We guide them to healthcare. If they want to go to detox, we take them to, we have a way to get them into detox. If they want to talk, that we'll talk. That's one thing that's, to me, that's unique with the Peer Network of New York. We also establish a special relationship with the participants. We consider ourselves as a walk-in information center. In other words, anything they need, we try to provide for them while we're out there in the streets. Advocating, like I said, we advocate, for instance, it's a beautiful thing that the OPC's finally open. For years, we've been going up to Albany, having lobby visits, protesting, yelling, marching in the streets for years until we were able to get these OPCs open. Like was said before, OPCs have been, or safe consumption sites, been around the world for years. And this is throughout other different countries. And in any of those countries, there's been over 1 million served but not one fatal overdose. And that's a blessing. That's what we're trying to bring into the United States. The main thing in New York, we just opened one last year, the end of last year, and already, like we said, we saved over 100 overdose already, and this is just in one part, and this is not even at the epicenter of where most of the overdose happens. So we continue to do that, and like I said, the boots on the ground is a very, very, very important, because like I said, the relationships we establish with the participants is like a trust. We deal with them with dignity and respect, and they accept that, and they open up, because the stigma which follows behind the people out there that use drugs is unbelievable. But at the same time, when you establish such a trust, they come and open up. They'll tell you what they're going through. They tell you actually what they need out there in the streets, you know what I'm saying? And who else to know better what they need than the people out there in the streets, what we need. Thank you.
If I may add something real quick. Real quick, I just want to add something. When we think about the 100,000 overdoses, when we think about that, the fact that there has been overdose prevention centers in Canada since 2003, when we think about the fact that many on this call right now have been having this conversation since 2007, 2008, and now, right now in 2022 is the time when we have them open, but we have other statutes. Well, they're not signed into law. We have federal crack house law statutes in place right now where people are scared to really open them and do what needs to be done. We need to address that. We also need to think about, when we talk about overdose prevention, overdose is something that is preventable, ladies and gentlemen. So we need to say overdose, but something that is preventable. We need to talk about not only safe consumption sites, but we need to talk about a safe supply. I used to be an individual that would advocate for decrim. Now I'm going straight to legalization, because if we didn't have an adulterated supply, we would have people would know what they were using, and people wouldn't be dying from something that is preventable that we're calling overdose. Now that these rates are so high right now, and these cities right now, we have something that's called Operation Overdrive. Operation Overdrive is now that it's predominantly Black men that are dying, and it's because of the gun violence that's in these cities. The DEA is now being funded to come into many Black communities and to arrest and lock up when they say they can't arrest their way out of the situation. So we want to talk about, through harm reduction, other ways in which we can help our community and our society to save lives. That's what it's about. Boots on the ground, treating people with dignity and respect, getting social and economical ways of funding to actually do the work to change and save people's lives, if that's what they want. We need to normalize drug use. Why? We have open consumption sites right now already, ladies and gentlemen. They're called bars. A lot of people go to bars, and what does a bartender do if you drink too much? He calls you a cab. I know some people don't like to hear that, because it's legal for you to take a drink, because when we had prohibition of alcohol and it was taboo. Now we have prohibition of other substances. We need to have the hard conversations of normalizing drug use, normalizing drugs, because people use drugs. Not everybody, but these situations or these issues that we're talking about are not going to make more people use. The people that are used, they're going to use, and they're going to have other set resources. And I'm going to stop there, because I could talk and I go on for hours.
Thank you, Hiawatha. And thank you to all the panelists for laying out just where you're from and the impact of the organizations that you're working with. And I think what's most impactful for me as a government stakeholder is the ways in which the different nuances of the services that are provided by each organization work together. And I think that it's amazing to see work from boots on the ground, direct service, where people need to be met where they're at, all the way up to advocacy on the federal level, up to the Supreme Court, all to kind of distinguish what it is that people need to heal. And as Marilyn said, to receive love and to be open to what it means to have harmony in our communities. And that often is tied up with equity. So thank you, Melissa, for mentioning the overcriminalization of people who use drugs and the slicing line of racial equity that's evident in the way that Black and brown New Yorkers specifically are dying at higher rates. And in that vein, especially in the Bronx, which often is overlooked, and at one point, I believe in the Bronx, in the South Bronx, in my haven, per square mile, the AIDS epidemic rate of infection was at pandemic levels. And this is in the 1990s. So we're talking about comparing the Bronx to countries in the global South who are particularly more under-resourced than ourselves. And so when we're talking about harm reduction and meeting people where they're at, we're just going to open the floor to panelists to speak about how criminalization impacts the need to or inhibits the ability to get services, and what kind of resources are needed to specifically serve Black and Brown people who are struggling in this way. So, and the floor is open to anyone who wants to go ahead.
Yeah, I'll go ahead and take a stab at that, because that's actually something that's been on my mind recently. Hey, everybody, again, Mimi Shelton, Destination Tomorrow. So again, the population I primarily work with is a trans and gender nonconforming population, as well as lesbian, gay, bisexual population, queer questioning. So across the spectrum of sexuality and gender. We also work with individuals with GED programs and job readiness program who may not necessarily identify within community, right? And of course, we're located in the heart of 3rd Ave and 149th Street. I think, I could talk about that environment in the Bronx, in the South Bronx particularly, and how hard it is, and how under-resourced and marginalized and forgotten it seems like so many people are there. It's sad to see, as an individual who, I come from Virginia originally, and I've been in the city for the past 5 years. So just watching the deprivation and the disconnect of economy from one area to the other, right? Because I'm riding up the east side of Manhattan to get into the South Bronx from Brooklyn every day. So I mean, I quite literally ride through multiple economic demographics each day, and so to see the vast disparity in the same city is just astounding to me. But to the question about criminalization, I think I will start with saying, even in working in nonprofits as a whole, I look at how even nonprofit staff, and this isn't talking about my staff particularly, but I'm just saying in general, I see how nonprofit staff individuals often approach and treat clients or speak about clients. And I think as a whole, sometimes we forget to see clients as humans, and sometimes we focus on them as a deliverable, a number, or a client, or a file number. And we don't actually always understand the ways in which sometimes we, and I'm talking nonprofit individuals as a whole, and state and government officials, how we are seeking to help and support individuals, but oftentimes, like, we have to ask ourselves and really say, like, do we have judgment? Are we placing ourselves hierarchically in a position of authority over this individual? Because sometimes what that does is it can determine who we think deserves things, who we think doesn't, how we approach those individuals, how we feel towards them, how much distance we put in between our bodies and their bodies when we're seated in the same space, right? An individual can notice. I've noticed that, an individual can notice if you are putting your mask up just because they walked into the room versus if you've had it off the entire time. So I think it really is, it starts as small as individual interpersonal interactions, and it gets even larger as in, when an individual is seeking to access certain resources or to enter into certain buildings to seek specific help. I think that oftentimes we might want to look at people who are sick, who are ill, as individuals who are criminal, right? As individuals who are dangerous, as individuals who are going to cause harm. So we might confuse the way that someone is behaving in public when they are using a substance, misusing a substance, or when they are in a moment of suffering or in a moment of mental illness. And we might think and excuse that as something that is criminal, but that action is actually something that is illness. And just because we can't see that the illness is physically on our body, we recognize these signs that make us afraid, but if someone had a broken leg, you wouldn't like run from them, right? And be like, oh my God, your broken leg is just so disturbing to me and out of place. You would help them. But sometimes because the illness that's going on is inside and it is so deeply mental and emotional and physiological, we, the people who are often entrusted to care for them, medical professionals, police officers, government officials, we might confuse the behaviors of illness for criminalization. So I think that's where everything stems at, is deservedness. Who do we think deserves to have access to resources and care, and who doesn't? And the second thing, are we confusing illness for criminal activity?
That's right. I just want to follow up on something that Hiawatha mentioned right away. This idea of there is so much hypocrisy in our public policy and our responses, whether something's legal or illegal, licit or illicit, is really about, in many ways, politics and what Mimi mentioned about who is deserving and who is not, who's been othered, who hasn't. And the reality is what criminalization does is it kills people. And we saw that during Prohibition, when people were determined to drink alcohol and they made it on their own and they went blind and they died from the toxicity of the alcohol until it became legal. Same thing with cigarettes, which is basically, a manufactured poison that people use. And the difference between being legal and not being legal, and I'm probably quoting my one of my favorite advocates, Jawanza, is to what benefit does it, how does it benefit capitalism, right? If it doesn't benefit capitalism, then it is going to be othered, it is going to be controlled, it is going to be contained. And so we know what to do. If a bottle of Johnny Walker Red were in a box that went to your local package store, or sorry, that I'm from Massachusetts, that's what we call them, the packies, went to your local liquor store and somebody drank it and they got sick, there would be all kinds of regulations and systems that would come into play to address that bottle of contaminated alcohol. And we're in the same situation now with the contamination of drugs that people use. The issue isn't about whether people should use or not. It's about when they use, should they die from it? It's yes or no. And so that is really what we're dealing with in terms of the overdose epidemic that we're in, is contaminated supply and refusal to acknowledge, and this is what's gotten us into trouble for centuries, refusal to acknowledge human behavior. We don't like to talk about sex. We don't like to talk about drug use. And those attitudes helped the HIV epidemic spread like wildfire, because we didn't want to talk about sex or the kind of sex people are having, and we didn't want to talk about drug use and the risk it was in using it. And the idea, of course, that people felt like you deserved to die if you were a drug user. You deserved to die if you were having the kind of sex that didn't lead to making babies. But in response to your question about what kind of resources are needed, and this conversation has been happening, it's nothing newfangled or something that we haven't heard before. What we need to do is person-centered services. So why do we have 9 to 5 services when people's lives are 24 hours? Why is the only 24-hour service that we have the police? And then we use the police to respond to issues that they shouldn't respond to. If we fully funded that which we care about and should care about, housing, people who use drugs, food, you name it, we have always, excuse my French, half-assed the supports that marginalized people needed. We have never seen what it looks like to fully fund or to fully resource the assistance that people need. Excuse me, let me check that. We have with COVID. Things that we were able to do during HIV, things that we were able to do during overdose, things that we're able to do during COVID, you can definitely marshal the resources. As an advocate, never believe there's not enough money. There's always enough money. It's about political will, and it's about the value of the people who need the resources that can be directed to them. So we need a kind of more person-centered approach to the services that people need, and we need to have the people design what the services should be rather than the people who are working to deliver the services. We should all be putting ourselves out of business. All of the not-for-profits should be putting ourselves out of business, but that's not the mindset. And because it's not the mindset, it means that we're patching people up and we're putting them out not fully healed and then waiting for them to come back again because, as Mimi mentioned, that's about the deliverables. So
yeah, and just picking up on that, I mean, 100 to everything Tracy just said, but criminalization kills people. Like, I think we have to keep coming back to that. And because it is so stark, it is so clear. I mean, when we look at the fact that overdose is the leading cause of death for New Yorkers who were experiencing homelessness, that becomes abundantly clear. You know, the reality around homelessness and overdose is really stark. It led to, there was an 81% increase in overdose deaths among people who are experiencing homelessness just from 1 year under the pandemic, really showing that, you know, when everybody else catches a cold, it's an impossibility for people who don't have any resources, any safety net to fall back on. So when we talk about saving lives, when we talk about the immediate impacts of criminalization, that's what we're looking at. And as we're having this conversation right here, right now, today, there's final negotiations happening around the New York State budget. And there's an effort by certain people to try to include provisions that would basically have coerced treatment, that would allow for really draconian parameters where law enforcement judges would be able to remand and mandate the people who are experiencing homelessness just for the mere fact of not being able to meet their basic needs, would be mandated into basically a psychiatric black hole from which it would be next to impossible for them to ever come out. And they would be able to do that without any sort of due process for people. They would be able to do that without any sort of regard for people's civil rights that should protect them from an unconstitutional act like that. But that's what's being discussed at tables literally as we're having this conversation right here, right now. So it is, you know, it's not something that's, you know, conceptual only. It's not something that's in the past in New York. It is very real in this moment that people would rather criminalize the folks who are the most vulnerable instead of giving them the resources that we know, that, as Tracy was saying, that we can muster when we want to. When we determine as a society that people are worth saving, we can move mountains to make that happen. And it's very clear the disregard that the people in power in New York have for especially people who are experiencing homelessness with the sort of criminalization tactics that they're trying right now. But overall, in the course of people's lives, we know that even low-level contact with law enforcement has lasting negative physical and mental health consequences and is likely to really exacerbate a lot of these underlying issues that people are having as well. The New York City Department of Health and Mental Hygiene actually did a whole study around this. And the former health commissioner actually said even brief contact with the police or indirect exposure is associated with lasting harm. So that brings us back again to, you know, what do we need? Of course, we need to actually, you know, shift our resources from, you know, further compounding, further harming people in a way that is clearly documented, that we know, instead of fueling involuntary detention that we know is not sufficient in any way, shape, or form to actually address the pain that people have and causes far worse situations for them. We need to double down and actually have evidence-based drug treatment and quality healthcare and mental health services, including low threshold options. You know, that's a lot of what we've been talking about today. And that means expanding supportive housing across the state, removing abstinence prerequisites to house people. We know that people are more likely to be able to move into a place of stability when they have a roof over their heads. We can't put a prerequisite on that. We just got to be able to get people the services that they actually need up front. But a lot of that has to do straight up with transferring our resources from vectors that cause harm very directly to people, cause death directly, and also cause lasting harm and pain, and moving those into vectors that are instead about building up individuals addressing people's care and needs and addressing entire communities in a much more holistic and comprehensive and compassionate way.
I want to add something real quick. I started this off by saying you can tell a society by how it treats its most vulnerable population. The Bronx, if it was a state, it would be second in the nation for overdoses. A little county, the Bronx itself, it will be second in the nation in overdoses. The shame is that it has been second and third in that category for years. Mm-hmm. This is nothing new. So when we talk about the over criminalization of people, we have many issues that we're talking about. No one in the second grade said, when I grow up, I want to be homeless. When I grow up, I want to be using drugs and or this, that, and the third. So the social economical issues that we are talking about, we have been talking about for years. We have been talking about putting more money into harm reduction, into harm reduction services. We were told we needed sound science, and we provided people with sound science. The shame of it is that what we allow is we allow people to come into the community and make promises and do research studies and this, that, and the third. And they have this idea that we don't know what we need, or our communities don't know what they need or want. But they have this missionary complex that think that they can save us, when they need to understand that we can save ourselves if we have the resources, if we're given the opportunities. We've been asking and telling the communities what we need. We don't need police to come on mental health calls. But if you ever talk about defunding the police, they think that you're talking about getting away with the total police department. Well, you know what I say to that? Get rid of them. Because we have people that look like me didn't have no part in constructing no police force. They were designed and made for what? For slave catchers. What else were they designed and made for? After the Reconstruction period, they were designed to do what? Arrest people for loitering, which they never had, for transparent vagrancy laws that they never had. So individuals who just got out of slavery, moving west and north, were getting arrested because they didn't have so many dollars in their pocket, because they were traveling through other said communities. This is what the police was designed for. And then other things came about. We need to reconstruct the police force because they're doing exactly what they're designed to do. They're designed to keep people oppressed, not to stop any crimes. They come after the crime has been committed. They come to keep people of color oppressed, down, and targeted. How in the world can we have a stop and frisk law and it's done away with, and now people are still being stopped and frisked, and now we have the DEA in our communities? As soon as the numbers of overdose become Black men, is send the police in because they have an excuse. So let's talk about gun violence, send the police in. A crime hasn't been committed, but yet you have the right to just stop people living in their own neighborhoods and stop them from doing things. That ain't right. We need to invest money in everything that's been talked about. Sound research, sound science. We have been providing it for years. Every year we provided, the numbers of overdose rates still go up. Remember, overdose is something that's preventable, ladies and gentlemen. We know what needs to be done, but no one wants to do it because we have a morality clause that states that drug use is bad. Prohibition is what kills. Lack of knowledge is what kills. We provide people with information so that they can make an informed choice. And we provide the information to politicians, but nobody, only a few, want to step out on a limb by themselves. New York, we used to lead the country in our choices. We used to have innovative leaders that stepped out and did what they felt was right. We need more of these leaders once again, because the world follows our drug policies, ladies and gentlemen, the world. And that's what we need to take heed to. Do the right thing. Help the people in the community do what we know is right, and just show a little compassion, love, dignity, and respect for all of us.
Right. So I just want to ask, I guess I really appreciate that the Office of Public Advocate is putting this event on to raise people's consciousness and awareness of what's going on in terms of the overdose crisis, and also putting a highlight on the strategies that work. So I just really would love to, and I see in the comments that there's information about this, the first time ever overdose prevention center that is being run by On Point. No lives lost, lives saved, interventions, meaningful interventions, connections to care. That's the whole point of it. And so so much of this conversation centers on drug use and people who use drugs. But I think Hiawatha really made the point about these are systems that interlock with one another and feed off of each other. So the harm is from these systems. Harm reduction is a strategy that's about love, and it's about either you want someone to live or not. But harm reduction, the work that is happening, that the peer network does, that Vocal does, that Jason and Sam and folks are doing, that is about a resource to the community to help it live and be healthy, right? And so I hope that there will be an opportunity to really talk about some of the incredible intervention that this center is, because it's not just about people going to use their drugs safely. As some of us who have visited the site, who know what the site does, it is a hub of safety and activity, and people in the community know it's there. This is the idea of no wrong door, right? You walk into the center and you're going to get what you need, what you say you need, right? And that's really what harm reduction is. If I say I need food, if I say I need safer sex materials, if I say I need a clean syringe, that's what you're going to get. And that builds trust and engagement in a way that we simply have not invested sufficiently in. So, Jason, I don't want to put you on the spot, but just even in a given week, what happens at the OPC, people should understand, because there's a lot of community pushback against people who use drugs and people who have chaotic drug use, but they need to understand there is a way to engage folks.
And I'm sorry, and Jason, real quick, how many people, because of y'all, people haven't been to the emergency room, and how much money that saves the state, the city and state?
That's right.
Yeah, thank you. Yes, I was gonna chime in and say that is that this is something that we're doing, is lifting that burden on the community. The fact that our centers are open means that folks are not using in the street. Our playgrounds are cleaner and safer. Our school grounds are cleaner and safer. The subways, same deal. We had a call from the Parks Department in February who was curious about what was going on with the syringe litter in the park. They mentioned that in December, they gathered about 13,000 syringes. And keep in mind that this is the park across the street from Corner Project. We were building out the OPC, so Corner Project was under construction for some time. 13,000 is a lot of syringes. In February, they called because in January, they only picked up 1,000 syringes. And that correlated directly with the amount of haz waste we were seeing from the overdose prevention centers. They posted earlier, we talked about the numbers. If these things weren't criminalized, homelessness, paraphernalia, the drug use, etc., these numbers would be so much higher. The city indicated or anticipated 130 overdose deaths, overdose interventions in the year between both OPCs. To date, in 4 months, we've had 226. So we surpassed their number in less than half the amount of time that they anticipated. We've served over 13,000 people. Again, this is a direct reflection of what's going on in the community. These are 13,000 instances of consumption that are not happening in public, and 968 users. So people are like they mentioned, people are aware that we're open and they're coming in. Our outreach teams are out in the community trying to divert public use as much as possible. And I think that it's working. We can't criminalize homelessness. We can't because it's cold outside and folks are moving from the encampments in the park into the subway, doesn't mean that the response should be, all right, let's criminalize this, let's give them tickets, let's get them out. No, we should be redirecting our resources into programs like ours and Everyone's Here, so that we can better serve the community.
Thank you, Jason, for mentioning that, and Tracy for raising that question. And again, we're here at convening this conversation because we know what works, and oftentimes our decision makers, when it comes down to budget, tell a different story. And so part of that is because of what folks mentioned on the call, the stigma associated with drug use that lines up with the targeted mass criminalization of individuals because of racist, capitalist colonialism on which our country is founded. And that value system of exploitation is what sets up institutions to crush those who are considered the most criminalized. And so, yeah, we definitely have a lot of feedback, and I want to give the space for folks to kind of give some examples of lived experience in the ways that overdose prevention centers and the safety hub that's formed around them with wraparound services actually help and change lives. I think we have a lot of feedback of people identifying danger, but often people don't understand the stories and the pathways that people navigate, and the need for third-party navigation services, peer-led navigation through other agencies, are things that have come up in conversation. So if folks would love to speak on the real ways that we need to change our service delivery systems and who should be those actors in those positions, that would be great right now. Anyone could go ahead. And if Jason, you want to continue, that's fine.
So again, for some of us who were working in New York during the early 90s, when HIV, people were getting a diagnosis and, dying before they were able to get their benefits. That was a time that in the face of the emergency, we were able to be innovative. It would be great if we could apply some of the things that we know work from the emergencies into the regular course of business of engaging people who are marginalized and who have been pushed away from the systems that we're claiming we want them to connect to, right? And I mentioned that because of the discrimination that people who use drugs or are perceived to use drugs encounter in social services and in healthcare services is enormous. So even though the services are there, if there's hostility, if there's rudeness, if there is, just this kind of disgust in dealing with someone who is in the midst of their health crisis, as Mimi pointed out, then what's the point of the service? Legal Action Center actually just did a report on discrimination in the emergency room by hospitals when people come in after being revived from an overdose, and just that these hospitals and these emergency room staff are likely violating a number of laws when they deprive people of that kind of engagement and care. But because we have criminalized the behavior through the war on drugs, through institutional racism, that people avoid these places where they're supposed to get care. And fortunately, there are places like the OPCs on point where people go and they know they're going to be welcomed, they're going to be embraced, and they're going to be addressed. So that's part of what we want to elevate, is making sure there can be more approaches like this. We've been talking too about other kinds of approaches, things like making medication, for opioid use disorder available to people in jail and prison, but especially in jail because people do short stays. The people who overdose the number of overdoses of people who have just left a correctional setting is something like 150 times more than in the general community. And that's because when people don't have agonist medication, whether it's buprenorphine or methadone in their system, they're at high risk if they pick up for overdosing because everything is fentanyl. And so these are the kinds of things that we refused to do 5 to 7 years ago that we have found it now necessary to do. And again, never believe anybody when they say there isn't enough money. There is so much money. The opioid settlement money that is available to New York State and in many states around this country are bringing in resources to address these very kind of needs. People involved in the criminal legal system, people with co-occurring disorders, people who are homeless. There is money to address those issues, but the money will not be well utilized if we're not aware of it and if we don't demand it for our communities. So I just want to, put that out there in terms of people's awareness of what they can do to make sure that programs like On Point can be replicated and can be utilized by the people who need them instead of NIMBYism and shaming and criminalizing people who use drugs. We've got approaches that work and make sense, but we have to have the courage and political will to invest in them and put them forward in a way that works for people.
And also to piggyback on what Tracy just said, just today, like I said, I'm boots on the ground. There was this one participant we seen, and he had bad wounds on his hands. So what we decided to do was today we had nurses on scene. There was at a certain location, and the participant didn't want to go see the nurses. The reason why, because the stigma. He was he was so used to being, when people see him, they'll look at him, go show their face, because also too, you got to look at the language, the negative language. Okay, the negative language also, the negative stigma is also in body language. So it wasn't until he trusted me. In other words, he trusted us out there. The relationship we established, we walked him over to the nurses, and that's when he was able to say, okay, he'll get the treatment. He'll see what they have to say, how to treat his wounds out there. Because like I said, the negativity and the stigma behind way people look at people that use drugs out there. And I work in the South Bronx, in the Epic Center. And a lot of participants tell me the same exact thing all the time, is that Lincoln Hospital is right there. But lots of times the reason why they don't want to go to Lincoln Hospital because of the stigma, which is behind where the doctors looked at them. When they walk in, like you said, they don't have to, they could act like they're okay, but the body language, they read body languages. Because you got to remember, most of the participants, they know how they are. They know how, they might smell. They know that, but still, they want somebody to treat them. It's bad enough that they're self-conscious of what they're going through already. They don't need for a doctor, a professional, to give them the same thing because they feel worse about themselves. And that's why lots of times they don't want to go to the hospital. Like I said, I had to actually escort the brother there, introduce him to the nurse, made him feel comfortable with the nurse, for him to show his hands, and see, and would let them go ahead and do what they had to do and tell them how to treat their wounds out there. So the stigma is very, very, very important because they read it. They're in the streets, they could read stuff like that. And that's not just by the mouth, but the action, body languages. And a lot of times people don't realize the body language is the most important thing that a participant picks up about how they feel going for certain services at certain places.
And peer work is also very essential, and it's not funded. They're not paid right.
That's right.
Right? Because let's talk about who I can reach. I have lived experience. I've been criminalized. I have been a drug user. And I can reach someone like this because I can relate right away. I meet people in the ER that just woke up from a non-fatal overdose. And it's just building that rapport. And once you start building that rapport and you share your live experience, sometimes, not all the time, but most, it does help, because it just brings a person is willing to open up because they know you've been through the same thing they have, and you can assist them in getting whatever it is they need. Because I ask them what you need. I don't tell them what to do. I just ask, what is it that you need so I can help you with? And we set up some goals and we do it. And I can escorting them to appointments, escorting them to MTA, to the MAT, methadone or Butte treatment center, or just escorting them to places where I know that where I would go if I had to go there. I know that I would be treated right. I'm not going to take them to these agencies. All they do is stigmatize you, judge you, talk about you afterwards. I always try to find a place where it's loving. OPCs are I take a lot of people there because I think for me, it's the place where I would want somebody to take me, because it's wraparound services. So I think peer work is essential, and it's the connection. It's the connection to assisting people there on the ground, because we're grassroots.
Yeah.
That's it.
I think that's one of the things that are like super important and unique about On Point NYC is that we have that wraparound services, right? So once, like we said, it's not just about them consuming. Once we get them into the OPC, that allows for those more intimate encounters to happen, right? They're having the experience. We're guiding them through that the safest way possible, and then those those barriers start to come down, where they start to identify really what's going on and what they really need. And for a lot of our folks, like you've all mentioned, it's really like places like ours is the last stop, right? They're not getting treated with dignity and respect everywhere they go. So when they come to us and they see that we know them by name and that they feel seen and heard, it goes a long way in that relationship building. I've been in meetings where, there are city officials talking about their staff are scared to engage with folks in the street just because they're homeless or just because they suffer from addiction or they're a drug user. And I'm in the meeting like, we're not. Like, I'll send my team right over there. We can go talk to them, find out what they need, why they're there. And like it goes a long way to the work that we do. It speaks to the compassion that we have and the humanizing experience that we're providing for the participants. Yeah, I also wanted to add that we're doing a significant amount. We're doing what we can to really address the syringe litter issue in New York City. I know, like we say here at On Point, where there was once a syringe, there was once a person. So we piloted this program. We have our public safety hotline, and our teams in Washington Heights and in East Harlem and the Bronx are doing their best to respond to calls at this hotline and pick up the syringe litter or divert public use. So I'm just going to ask that we share that in the general comments section, so that we can get this out to everyone.
Although I would just add, and I want to point out, again, that we invest on the expensive and we don't do the things that have a big impact and cost little. A lot of people know that I truly believe if we could figure out a way to pay 2 to 3 cents, 5 cents for every syringe that's discarded syringe that's out in the community, just like you can't find bottles and cans, you wouldn't find any syringes. And trust and believe the amount paid for those collected discarded syringes would be, by magnitudes of a million less than one case of someone being accidentally pricked. You would think even the sanitation department would endorse this approach. But again, we know what to do. It's been mentioned over and over again. It's about the will to do it and the willingness to use the money to do it. If Jason could be available the same way that you can call a police officer, What do we need police intervention for? It's not about defunding the police. It's about understanding that there are other ways to spend the money. And it's not about, giving up the police, but let's use the police for what we need the police for. We don't need the police to come and respond to what is a health and service emergency.
Amen. One thing I want to say real quick is, as we talk about the need for the peer worker, let's also talk about stopping the exploitation of the peer worker. Okay, because too many times, a lot of these entities. Okay, first of all, what harm reduction is based in principles and practice. So please don't tell me because you're giving out naloxone, but you're calling somebody a crackhead or a dope fiend that you're practicing harm reduction. Because harm reduction is about language, which is so important. It's about the principles and the practice together to be harm reduction. Now, a lot of people say that their peers and their frontline staff are the most important persons in the backbone of their said entities, but they won't pay them correctly. Something's wrong with that. If the most important people, in my opinion, is the outreach worker and that receptionist, because they represent the agency and they represent the work. And regardless of what they're going through, they are so important because they direct people. When the person is on outreach, they are, as you heard already, walking resource centers. They're not just out there picking up syringes or giving out syringes or picking or handing out naloxone and Narcan. They giving people information so that they can make a decision. They sending people to detoxes, or they calling a van to come pick them up. Whatever's going on at that time, they're providing them with information. Because during COVID, the peer network and others that were out there doing this work, for individuals that didn't have communication devices, we had to go out there and give people updated information and factual information on what was going on with COVID, what they should do, what they shouldn't do, how to dress, supply them with PPE gear and everything like that. Now, we cannot have the peers saying that they are the most important people doing the work. They have lived experience, this, that, and the third, but yet we want to treat them as second-class citizens or other them. They have to be treated with dignity and respect, and they have to be paid a livable wage if they are most important people. And the thing is, too, that we cannot put a ceiling on them. When they come in, they should be getting leadership development. They should be getting other said trainings so that they can elevate within the entity and not just be something, so someone just being used for just that one thing, because that may not be what they want. Some people are going to be on outreach and ground pounders all day long because that's what they want to do and that's what they love to do. There are going to be others that's going to come into entities, going to do the work, and they may want to learn and elevate and do other things. There's no way a harm reduction case manager and someone who's doing case management work, why is that person getting $60,000 and the person doing the harm reduction case manager, because they appear, getting $15 an hour? It's not right, in my opinion, and we need to change that. We need to change that across the board, because that individual peer, because they have lived experience, as you already heard, they can relate to the said individual. They can talk to that said individual. And let's think about some things that we have to fix. When we say clean up the streets and send them to the shelter, maybe they were beat up or robbed in the shelter. Maybe they were raped in the shelter. I'm talking about men and women. When you see someone that has a foul body odor, they know it, but it may be for protection. But we don't think about that. We just want to say, "Oh, you smell, get out of here, go away." In harm reduction, we don't do that because we don't know the story. 9 times out of 10, there's a story behind almost every action. But we don't think like that. But that's how we think in harm reduction. What's going on? And we try to work towards to find that out. But that ain't the first thing that we talk about. The first thing is about building a rapport, treating somebody with dignity and respect, like we all want to be. Treating someone and giving them a human connection, because a lot of things, what we're talking about really is disconnection. When you go into a encampment, and as the mayor is doing right now, tearing all the encampments down, there was a harm reduction agency that was going to that encampment and servicing people. They knew where they were at. They were getting other said services. Now we can't find them, and we don't know where they at. They re-traumatized by the police being on scene, scared they're going to get locked up, scared if they don't have ID, or what if they don't have a green card or anything like that. But this is supposed to be a sanctuary city. There's a lot of things that we have to think about, a lot of things that we have to talk about, and a lot of things that we have to fix. It's most unfortunate. And listen, me, myself, the Office of the Public Advocate, I am so glad that they're having this conversation and they're allowing us to speak our truth and that they're listening and that they're on board with a lot of the things that we're talking about. Thank you very much for this opportunity, and there'll be more later on. But we must do things differently. We have to do things differently. We know what works. We got to put the money in the things that we know that work. The peer network was also a part of a feasibility study. We did participatory research. Wait a minute. You mean to tell me drug users, homeless individuals, people from the LGBTQI community? Because the peer network is comprised of everyone. They did community research. Yes, we did. We can do anything we set our minds to, and or if we give our people the training and the time to do so, the experience to do so. We are some of the most innovative creatures on the face of the earth. A lot of times we wasn't given the opportunities. We don't know what led people to what it is that they're doing, and I really don't care. And I'm not ready to talk about it until they're ready to talk about it. When they're ready to talk about it, they'll let you know. But in the beginning, of course, they're gonna give us the surface stuff because everybody else been asking them the same questions that some of us been asking them. So they're gonna give us what they think we want to hear, and then the truth comes out later. And we have to understand that everybody needs and wants connection, but we need to do it in a different way, in a better way, and we need to make sure that our politicians, our donors know how we do what we do, so we can do the work. And I mean, those entities, they know who they are. I'm not gonna call nobody out, not this time, but it's coming. It's coming. Do the damn work. Stop saying you're doing the work. Do the work, especially if you're getting funding. You know what I mean? Do the work, get out there, get on the ground, do the work, and lead by example. Don't worry about what everybody else is doing. And if you have an issue with someone, talk to them. That's communication is everything. If I come in your territory, hey, oh, you there this time? Listen, our community is out there 24 hours in a day. If you're out there from 8 to 5, I mean from let's say 11 to 2, why can't I come in that same area from 4 to 7? You're not out there. The community is still out there and still in need. We need to think like that and stop working against each other and work more together. Because this is what we need to do to service the whole community until we get to being able to do this work 24 hours.
Right. I agree with Aya on the peer point. This work was definitely built, harm reduction agencies like ours and every panelist here, everyone in the comments. It was built on the backs of the peers. They're the boots on the ground. They're the ones with the most experience. We rely on them the most for that knowledge and information. So shout out to all the peers that have laid that groundwork for us. And to that point, we hire from within, right? We hire from the community that we serve. We make sure that our leadership team has representation from the community that we're in. So right now, On Point has like over 50 vacant jobs. We're looking to expand 24 hours. So we definitely are looking to bring more peers on and folks with lived experience. Our entry level is 18 an hour. So our peers are paid. That's the entry level for them. And then of course there's always that opportunity for growth and professional development. Me myself, I was able to work my way up. I came in one position, and after some time of putting in the work, I was able to ascend into the directorship and the leadership ranks. But we have so many examples of that. Like we our Narcan manager Izzy was someone who started off as a participant and worked his way into a manager position. Same thing with our folks like throughout the program. We have so many examples that we can give that we can go to. We have navigators, people who work in the OPC. So we're really looking to make sure that we maintain that representation from the community, that we don't lose our way in that sense.
And also too, I'd like to piggyback on the peers too. We got to remember, most of these organizations are getting they're funded from the numbers. Who are they getting the numbers from? Are the peers. That's number one. Number two, you got to remember the peers go out in dangerous places to get these numbers. You know, you never know when we might be out there serving the community, and at this particular time, a drug deal might go wrong. You know, that's why it's important that when we go out with peers, we don't go alone. We go with people so we can watch each other's back. The relationship which we established over at the peer network in the South Bronx right now with the community, that there's been a couple occasions when situations wasn't right. They'll tell us, get away from here. Y'all don't need to be here right now. In other words, that's the relationship. Y'all need to be here right now. It's okay. Go ahead. We'll see you tomorrow. The reason being because something is happening and they're looking out for us. But that just goes to show the importance of the peers and the importance of the relationship we establish with the community that we serve. So when we hear one thing that gets to me a lot, when they say, "Oh, you just a peer," you just a peer. Lots of times when they tell me that you just a peer, if it wasn't for just a peer, you probably wouldn't have a job. Because this is what we do. We bring in numbers and everything like that. But like I said, the relationship some of the dangers that we put ourselves involved there, if it wasn't for the relationships we have to the community when they were, like I said, a couple of times they told, go ahead, get out of here. Get out of here. All right? And the reason why we get out, we don't ask any questions. We just listen because, something's about to go down. And that's just the experience of the peers. But yet and all, we just appear. You get our numbers, you put it in the book, and then you get your funding.
Listen, the peer model works. In 1991, my executive director was a peer. 30 years later, he's leading this organization. So, that's the proof is in the pudding.
Absolutely.
Thank you so much.
But remember, at the end of this conversation, there is someone every 4 hours in New York City dies of an overdose. In the whole state of New York State, every hour and 48 minutes, people are still dying from an overdose. We are in a crisis, and we really need to come together and save our community, because we're the ones that are going to save our community. Nobody else is going to save us.
Preventable overdose.
And it's a preventable overdose. Get trained, train your community, train your family to use Narcan. I mean, we're in a sad space right now. And it's time for us to continue to work together to save lives. Because if not, we're going to continue losing more people. Mm-hmm. It's a public health emergency.
Thank you, Marilyn.
I'm sorry, Solomon.
No, I was just going to say, we're getting close to our time here, and I just wanted folks to share if there was one thing to share that people need to know about what harm reduction means and the work, and that what they need to know, leave folks with that. And Jason, you can kick it off, and then folks are getting popcorn in.
Sure. Really quickly before I leave with that parting gift, I just wanted to talk about Narcan and the OPCs. We've switched to microdosing naloxone when we intervene or in an overdose. So we're using a tenth of the dose of the nasal spray, so that's 0.4 milliliters, and we're using intramuscular. So we're no longer responding to overdoses or intervening in overdoses using the nasal spray. We're microdosing intramuscular Narcan. I just wanted to put that point out because it's something that's very specific to the OPCs. And in regards to something that everyone needs to know regarding harm reduction, I would say just move with compassion. You never know what someone's issues are, what their triggers are. So just be compassionate. Treat people the way you would want to be treated wherever you go.
Harm reduction to me is love. And for those that say they don't understand harm reduction or we just full of BS, I want you to know that you practice harm reduction. A police officer puts on a vest to protect himself from bullets. You close your door when you leave your house to prevent harm. And many other things that you do to protect yourself every day, that is harm reduction. So I leave it at that. And we all use harm reduction. Just because it's catered to drug use and sex work doesn't mean that it's not worth it. It's not worthy. Harm reduction is just loving your community.
For me, harm reduction, love, dignity, and respect for human beings. Number one, something like Hiawatha said earlier, life happens. We don't know what somebody's been through. As a matter of fact, today, April 4th, we make 19 years since I lost my mother. And when it had an effect on me. Also, I lost my wife and my 3-month-old son. That was life happening to me, and that's what got me out there for a while. Until by the grace of God, I was blessed through harm reduction to be to where I'm at today. But like I said before, like I said earlier, love, dignity, and respect. Don't look at another human being in negativity with some type of stigma. Look at them and say, life happens.
I want to quote Hiawatha, or as somebody called him in the chat, Hiawatha Damas. How we treat the least of us really reflects on a society. And this is it's about harm reduction, but it's also about, I'm afraid that we're going to look back on this time and realize that we were absolutely barbaric in the way that we treated people who had complex health issues, complex lives, and and I don't think that history will judge us well. But I am also hopeful, having lived through some of the worst of the HIV epidemic, that when people kind of come together and put they make the political personal and the personal political, we will get to where we need to be. But right now, I feel that we have nothing to be proud of with the number of deaths that are going on. We have absolutely nothing to pat ourselves on the back over as a society.
Preventable deaths. That's the shame of it. And thank you for that, Tracy. I mean, it's so deep right now because there's so much that I want to say and can say. But as a society, are we going to be looked upon with grace when we've been having these conversations for years? We have a president in his national address who mentioned harm reduction, and right before that, he only gave $30 million to the whole country for harm reduction, when New York itself could use the 30 million by itself. Um, so with the good, we take it, we say thank you, but you could have did more if you really wanted to do something, if you really chose to do something. And what really needs to be done within harm reduction does not need to be implemented. I mean, it does need to be implemented throughout society, but that society have to have a clear understanding that it's not just about drugs and or alcohol. It could be a way of life if we implement it in our lives. And it has to do with love, dignity, and respect, and humanity. And they say, how can you talk about humanity? Because humanity has to do it. I don't know you, but I love you and I respect you and I want you to live. It's not about allowing people to die from something that is preventable. It's not about having a society that you can't even. I mean, you have all these empty apartments and buildings around, but you have a homeless crisis, and not just single people, but families. That it's just appalling, and it's a shame that we are reaching these numbers in this country when we know what to do, but the powers that be won't do it. It's a shame because all the people that we continue to lose each and every year. This year, between COVID, the pandemic, and the overdose crisis and the war on people, notice I said a war on people, predominantly people of color. How many people have we lost? And so we're still in the grieving process. And we're not even over that, and we're still fighting this fight. We're grieving each and every day because a lot of people we were not able to send away or send off properly because of COVID. And we lost so many right behind each other. What we need, what we need is the implementation of real harm reduction, going back to the grassroots of practicing harm reduction and not allowing it to be co-opted by those who think it's just the new sexy and that they want just a piece of it because they can get money from. Give it to those people that are on the ground doing the work, and they will continue to do the work.
And I'll just add to that, that harm reduction is about meeting people where they're at, but not leaving them there. And that means both in terms of the way that we're actually designing our programs and making sure that the people who are the most impacted are actually the ones formulating what the solutions are in direct response to what they're experiencing and what they're seeing in their lives. And also making sure that we're doing that within our city, right? That means identifying what's causing the harm, whether it's in somebody's life and being able to work with them, as folks were talking about, building those relationships, or if it means looking at how this is playing out across our city, across our state, and what needs to happen there. Whether that means recognizing that somebody needs food, whether they need a stable place to live, whether that means connections with people. Ultimately, it comes down to compassion, dignity, and respect, as people have been saying. But it really is, unless that first initial interaction with them is about meeting them where they're at, non-judgmentally, with compassion, then you're not going to get anywhere. And we're just going to have this spiraling crisis that we're seeing already. So we need to really focus on being able to meet people where they're at, but not leave them there, and have the commitment to not leaving people there, as has been spoken about.
Thank you so much, Melissa. And thank you so much, Hiawatha, Marilyn, Jason, Mimi, Will, and Tracy, for just scratching the surface today of what it means to pursue healing for a society that has been long been broken by dehumanization and the commodification of the human life. And we're hoping that today this information will help change lives. And remember that we can save lives, but it requires us to have love and compassion. It requires us to build power, and it requires us to take the risk to truly pursue equity at whatever cost. And this is about saving lives, because people will die if we do not act every 4 hours, as Marilyn said. I myself have lost loved ones to overdose, people extremely close to me, and I know that many in this circle have as well. And this is why we fight. And so I just want to take a little moment to honor Elizabeth Owens, who's an amazing woman who changed my life and helped me to understand how to be human again. And for those of you who have lost someone, we just take a little moment right now of silence to honor those who have passed from overdose. It's not easy to fight the fight, but it is absolutely necessary to do so. And you heard it here. We have solutions. Don't be afraid of an overdose prevention center coming to your neighborhood. Don't push it away because you're afraid that it'll attract people who use drugs, because that's exactly what needs to happen for people to receive the transformative healing that they need. And it is, in fact, healing. We draw a correlation to young people who carry guns because 85% of them have seen or witnessed violence firsthand, have been impacted by it. And in the same way, people who use drugs often use drugs because of the trauma that is unresolved, trauma that is because of institutional racism, trauma from personal life experiences and spontaneous occurrences that could not be prevented by their own actions. So we must have compassion, we must listen, and we must let the experts deal with the situations in the way that they know how. We have to resource our peer navigators, who are the ones connecting the dots. They are not a focus group to be exploited, they are a workforce to be lifted up and resourced adequately. We need to reach people where they're at, like Melissa said, and not leave them there. And this takes all of us to act together, both from the grassroots to the nonprofit industrial complex and to this government industrial complex that reinforces often the same harm we're simultaneously trying to remedy. And so, New York City tonight, you've heard how to do it. You know who the actors are. You know what the solutions are. So please reach out to your city council members, reach out to your state assembly members, reach out to your Congress people, so that we can make a change that is necessary to save lives, because that is what's at stake, and we have the power to change these things. There is enough money, as Tracy said, and $30 million is just a drop in the bucket for what we need. And if we say this is the key to reaching the least of these, we connect the dots to other things that are also limited, such as homelessness, such as those who are surviving through sex work, and those who are seeking true help for serious mental health issues rooted in trauma beyond what we can conceive. So please, New York City, have compassion, have love, and remember, build power and save lives. And thank you for joining us tonight. To all the wonderful participants on this panel, thank you again. And this is one of many more to come. And if you need any other information, feel free to visit the Public Advocate website, and you can be connected to information like this and resources provided by our partners. So thank you again, New York, and have a wonderful night.
Thank you.
Peace and blessings. Good night.
Thank you, everyone.